Well, COPD affects more than 24 million Americans, and many folks are not even sure of what it is. Dr. John Pierce knows what it is. He works at Preventative Diagnostic Center right here in Las Vegas. Joining me today to talk about an amazing scan that he offers that can actually help people with COPD. Welcome to the show, Doctor. How are you?
Thank you. Thank you.
It's an acronym we hear all around town, or on television rather, and not many people really understand what COPD is. Can you define it for us?
Sure. So COPD is for chronic obstructive pulmonary disease. Basically, it's a chronic inflammatory condition of the lungs. Generally, it's characterized by a few symptoms: difficulty breathing, chronic wheezing, chronic cough, generally productive. There's two types of COPD. There's emphysema, which is destruction of the alveoli, which are the little areas in the lung tissue itself that transfers oxygen to the blood. And the other one is chronic bronchitis. So chronic bronchitis is inflammation of the bronchus, or the main airways of the lung. That's the one that's more associated with coughing, and particularly productive coughing. And this is chronic.
And is it sometimes brought on by smoking?
That's the primary cause of both emphysema and chronic bronchitis. So all COPD is typically from smokers, but other, exposure to gases can cause this as well. So you get people, that haven't been smokers, but they work in an industrial area where there are a lot of gas exposure, that can do it as well.
And how do you go about diagnosing this?
Well, for us, the scan that we can do of the lungs will show us these diseases. A chest x-ray might give some indication, but the CT scan is going to give a lot more information. It can also be diagnosed by a pulmonologist by doing some respiratory testings like spirometry and other pulmonary testing. But imaging is primarily the number one way to diagnose it.
Now, let's talk about this scan, because that's really what you do at Preventative Diagnostic Center. It not only can evaluate conditions like COPD, it also can find a whole lot of other conditions, anywhere from the neck to the groin, really.
Yeah, we found tumors in the thyroid, or just an enlarged thyroid itself. We found obvious COPD and emphysema in the lungs. We found lung cancer, unfortunately. We find plaque buildup in the coronary arteries that put people at risk for heart disease or myocardial infarction, heart attack. We found, cysts in the liver. We found liver cancer. We found cysts in kidneys. We can find kidney stones. We can find renal or kidney cancer. We've able to see right on down and through the gonads of both men and women. So we found issues with ovaries in women. We've able to look at the size of the prostate in men, and things of that nature. So if there's a solid tumor, we'll probably find it, because we can see abnormalities down to about the size of a grain of rice.
And I have to be honest, it's a little bit intimidating to hear all those things that you have found. However, as we know, with almost everything, early detection is key. Doctor, when you find something like that on a scan, what happens next?
Well, generally, I'll call the patient personally, or I have other healthcare providers that will make the phone call, and we inform them of the findings, and then we direct them to their primary care physician, because that's where they're going to get the most help. They see the primary care physician, now they've got a problem, and then they can refer them to the specialists that they need that are within their insurance programs, and hopefully it goes seamlessly for them.
Yes, exactly. With this amazing scan too, we want to mention that you get a calcium score, and that is key at understanding where your heart health is at. Right now, you have a special offer, and you have a lot of folks who come in solo. You also have a lot of folks that come in with their best friend or their spouse.
Yeah, we like it to offer it to two people, and generally, especially in a couple situation, you get both people in there. We've had the occasion where they came in and they thought the one spouse was going to have a problem, and it turned out to be the other one who didn't, had no symptoms and had the worst issues. So what we're offering now is a 2-for-1 heart scan, and this is going to look at the coronary arteries and tell us if you have any plaque buildup of concern. That test generally is $599 for one. We're offering it 2 scans for $125 total.
That is an amazing value, and just it's really easy. I've done the scan, folks. You just go down, you get peace of mind. It's a great time of year to do it as well. Dr. John Pierce, thank you so much for joining us.
My pleasure. Thank you for having me.
Preventative Diagnostic Center. They are located on South Tenaya Way. You can see their website right there on your screen, pdcenterlv.com.